Very good morning to everyone. Myself Dr. Divyang Mali, under the guidance of Dr. Manu Parmar sir, Professor and Head Department of Psychiatry, I am going to present the aims and objectives required for internship posting in Department of Psychiatry.
Okay, good.
The aim of the posting of an intern in psychiatry is to impart such knowledge and skills that they may enable him or her to diagnose and treat common psychiatric illnesses. He or she shall acquire competence for clinical diagnosis based on history, physical examination, and relevant laboratory investigations and institute appropriate line of management. He or she should also be able to recognize the behavioral manifestations of systemic illnesses and differentiate them from psychiatric disorders. Now, the scoring in Department of Psychiatry internship posting is based on knowledge, patient care, procedural skill, independent care, communication skills, system-based practice, and professionalism and lifelong learning. Now, the skills required in Department of Psychiatry internship posting are to diagnose common psychiatric illness, manage common psychiatric illness, identify and manage psychological reactions, diagnose and
Side
manage
effects
side effects
of drugs.
side effects of drugs, diagnose and manage behavioral disorders in medical and surgical patient, electroconvulsive therapy administration, therapeutic counseling and follow-up. Thank you.
Thank you, Dr. Divyang.
Now let's look at the instructions for intern doctors. First, Psychiatry department expects discipline, ethics, manners and morals. Second, everyone must come at 9 o'clock every day. Third, one intern should sit in the OPD and all the remaining interns should go to the ward to take history and round with teachers. Fourth, ward intern, do not leave the ward without informing the ward sister and write complete history in patient's file. Fifth, no one will be given leave. If it is very necessary, only 1 day of leave will be allowed. Sixth, activities must be done daily as per the internship logbook. Seventh, at the end of term, everyone has to give viva, then logbook will be signed by HOD sir. Eighth, write and submit 5 case histories with mental status examination like disorders of depression, schizophrenia, bipolar mood disorder, alcohol addiction, headache, anxiety, hysteria, OCD and intellectual disability. Thank you. This chart is made by intern doctors Dr. Divyang, Dr. Tif, Dr. Mitul and Dr. Ashish under the guidance of Dr. Manu Parmar sir, Professor and Head Department of Psychiatry.
Hello friends, good morning. Myself intern Dr. Dev Chauhan and under guidance of Dr. Manu Parmar sir, Professor and Head of Department of Psychiatry. Here we are discussing the general clinical and ethical training for intern doctors,
Right.
which should be first communication, history taking, preparing discharge summary, writing referral notes and other comprehendences. Second, perform a complete through physical examination and elicit clinical signs. Third, conduct cardiopulmonary resuscitation and endotracheal intubation in newborns, children and adults. Fourth, conduct first aid in newborn children and adults. Fifth, give subcutaneous, intradermal, intramuscular injections. Sixth, give intravenous injections and infusions. Seventh, adopt universal precautions. Eighth, demonstrate empathy and human approach towards patients and their relatives. Ninth, develop intra-correspondence and communication skills to discuss illness and its outcome.
Okay.
10th, obtain informed consent. 11th, motivate for organ donation, blood donation and autopsy. 12th, learn ethical management with principles of pharmacoeconomics. 13th, learn to provide informed choices to patients and relatives in terms of patient options like with current disease status, prognosis, benefits, cost, complications of chances, success rate, chance of outcome, scope of rehabilitation, chance of recurrence with all treatment options available and also scope of service in his establishments and availability elsewhere, etc. 14th, must understand that internship is last formal learning phase and skill obtained has much more to do with disease management than just theoretical knowledge. By 15th, to be eligible for final degree certificate, to be eligible for permanent registration of National Medical Commission, to be eligible for license to practice in India, to join postgraduate course is mandatory to complete the compulsory rotating medical internship in accordance with institutional curriculum committee criteria and also to satisfy the satisfaction of head of institute. 16th, if any of the internship posting is not completed satisfactory, an intern is required to obtain repeat posting orders from the head of institute in same subject for requisite duration. Thus, compulsory rotating internship is an integral part of of an undergraduate medical education degree. 17th, must complete compulsory rotating medical internship as per NMC graduate. 18th, must be to complete within 2 years from the date of qualification to pursue compulsory rotating medical internship and must not be for period less than 12 months. Now, an intern shall maintain a record of work in logbook which is to be verified and certified by the concerned supervisor or mentor under whom she or he works. Internship training shall be supervised. Second, an intern shall be given adequate opportunity to acquire competencies to become a confident primary care physician. Third, intern shall be mentored to acquire effective communications and other skills that are necessary for empathetic and compassionate clinical care. Intern must ensure that each intern gets learning experience in the community.
Thank you, Dr. Akhtar. Okay.
Yes.